Hello, my name is Andreas Barth, and this is my Healthcare Leadership Symposium presentation for Business 6370 Business Communication for Healthcare Managers course. The article I chose to review came from the Journal of Medical Internet Research titled Patient Satisfaction with Telemedicine During the COVID-19 Pandemic, a Retrospective Cohort Study. The authors were Ashwin Ramaswamy, Miko Yu, Siri Drangsholt, Eric Ng, Patrick Culligan, Peter Schlegel, and Jim Hugh. This study is quite relevant to the area of healthcare communication because telemedicine has grown substantially as a mode of communication between provider and patient, particularly since the beginning of the COVID-19 pandemic. In a study from the Journal of the American Medical Association, it was found that the use of in-person medical services dropped by 23% in March and 52% in April of 2020, while on the other hand, telemedicine services grew by more than 1,000% in March and more than 4,000% in April across this country. To provide some background to this study, New York City was one of the world's COVID-19 epicenters in early 2020. As of the 8th of May of that same year, there were nearly 176,000 confirmed cases and over 14,000 deaths due to the COVID-19 virus. This comprised 14% of all confirmed cases and 19% of all deaths from COVID-19 in the United States. During the pandemic, healthcare providers were forced to make a quick transition from in-person visits to video consultations. Telemedicine was an essential component of the healthcare medical response to the virus and the pandemic. Telemedicine technology reduced the demand on strained healthcare infrastructure and enabled healthcare needs of patients to be met at home while reducing exposure for both patients and medical staff. Up until 2020, research around patient satisfaction in telemedicine was very limited. Thus, the purpose of this study was to examine if there was a difference between patient satisfaction between video visits and in-person visits. The hypothesis of the authors was that there was no difference in Press Ganey patient satisfaction scores between video and in-person visits. The methods of this study. The study was conducted in New York Presbyterian Weill Cornell Medical Center in New York City. They used the Press Ganey Outpatient Medical Practice Survey, and this survey is used by more than 26,000 healthcare organizations, including over 60% of all U.S. hospitals. So it's a very robust and well-founded satisfaction survey. It evaluates 7 domains of patient care, including questions related to access, moving through the visit, the care provider, personal issues, and an overall assessment. This study was a retrospective study of patients 18 years and older after March 3rd of 2020, which corresponds to a Weill Cornell Medical Center mandate to shift the majority of outpatient care from in-person to video visits. Here you can see the breakdown of patients included in this study from the pre-COVID-19 period, which spanned from April 1st of 2019 through March 3rd of 2020 on the left side, and during the COVID-19 period, which was from March 4th through March 31st of 2020 along the right side. There were a total of 620 video visits, which constituted the study population. When looking at the results of this study, the mean age of the study population was 58.8 years. There were no significant differences in gender or other visit characteristics between the 2 time periods. Patient satisfaction scores were found to be significantly higher during the COVID-19 period when compared to the pre-COVID-19 period. Specifically, video visit satisfaction was significantly higher than in-person visits. This remained consistent during pre- and the COVID-19 period. Press Ganey scores of video visits did not change across the two time periods, and scores of in-person visits increased during the COVID-19 timeframe. In discussion, video visits were associated with greater patient satisfaction when compared to in-person visits. Overall patient satisfaction was higher in the COVID-19 period, and younger age, female gender, and new visit type were all associated with lower patient satisfaction scores overall. In critique of this article, I feel that this was an important study in that it captured a rapid transition of outpatient care to video visits associated with the COVID-19 pandemic in a large metropolitan area that was significantly impacted by the COVID-19 pandemic. With a retrospective study, however, it's difficult to establish causality between video visits and patient satisfaction. There may be other factors involved. In a retrospective cohort study, there are higher chances for selection bias as well. And the survey may not have adequately captured nuances related to video visits, such as video or audio or connectivity issues that perhaps the patients had. Also, with a study such as this, one is unable to really assess for non-responder bias. How do we know the thoughts and feelings of those that didn't respond to their surveys? This study was also limited to one facility in one area of the nation. The results really cannot be generalized to other areas of the country or specifically rural parts of the country. Some questions I have for you. First, what would you think would be perhaps a reason why the patient satisfaction scores of video visits were higher than in-person visits? How could a video visit encounter alter a provider's communication style? And how might these changes influence the overall communication between patient and provider? Also, what elements of communication might be lacking during a video visit encounter, which are present in an in-person encounter? Lastly, as a healthcare leader, how might you persuade a doubting clinician to embrace telemedicine and its benefits? Thank you so much for taking the time to view my presentation, and I look forward to your responses.